The answer to that is yes. I mean, a naturopathic doctor's training involves 4 years typically of undergrad, 4 years of naturopathic medical school, board exams, which also encompass basic sciences, clinical boards, and then each province or state that regulates naturopathic medicine has their own requirements, and then I also did a family practice residency when I was in the States. So along the way you get exposed to a lot of ways of helping people who have issues, not only mental health issues, but just issues that encompass all of medicine. We certainly can't treat everything, no doctor can. We definitely can assist in every condition that people have and help them optimize their health. I don't know if that answers your question, but that's the best answer I have.
Hi, if you get diagnosed with a mental illness and then often are put on ODSP, onto a disability, is there like sliding scales to see naturopathic doctors or orthomolecular available to people who are on a really fixed income?
At the Canadian College of Naturopathic Medicine, we do have a sliding scale for people on ODSP, people whose income is below a certain amount, and the fee for a visit goes from $40 plus HST to I think $15 plus HST or less. So all you have to do is call 416-498-9763, and when you speak to the reception at the clinic, you can ask for the form to be filled out that allows you to get a reduced fee. But if you want more information about that, come to me after. I'll provide you with the phone number. There's lots of people who can help you. I also see several patients every year where I don't charge them anything. I mean, a lot of doctors do that type of work because we know people need our help. Here over there.
I'm just wondering, I know there are very few people in Toronto that do this type of diagnosis, and I'm just wondering, what are the different things that you should be asking your doctor to check? I know B12, zinc, magnesium, but can you just give a list of the things?
When a doctor's helping to find underlying factors that may help in better treatment for a mental health disorder, there's a lot of tests that can be done. But of course, everything's always predicated on a good history, a physical exam, and then a search for other causes, which may involve blood tests. I'm not a fan of using every test because it's just not reasonable or practical. It's not a good use of resources. And frankly, one couldn't test for 40 essential nutrients. There is not one test that can accurately measure all the nutritional requirements that we have. But some of the things I do look for, I may look for undiagnosed celiac disease, and there's a test called transglutaminase antibodies, which can be run. I may run a red blood cell magnesium because magnesium insufficiency and or deficiency can certainly give rise to issues. I may look at a serum cobalamin, which is vitamin B12, ferritin, which is iron stores, a thyroid stimulating hormone to see if there's an issue with the thyroid and its production of thyroid hormones. So vitamin D, 25-hydroxycholecalciferol, the list goes on and on. The reality is, if the doctor is using only symptoms to help guide his or her treatment plan, then that's fine, but they're going to miss a lot of things. If a doctor is using a good history of physical exams, symptoms, and the judicious use of blood tests or other diagnostic procedures, he or she then is going to open the door to other avenues of treatment. But ultimately, everything will come down to trial and error. The reality is this: I do search for clues, and I do find a lot of B12 insufficiencies, deficiencies. Occasionally I'll get a low red blood cell magnesium. Occasionally I'll diagnose hypothyroidism or celiac disease. But more often than not, once you try to rule these things out, you're still left with this patient who's suffering, and you may not find anything, because not everything is so quantifiable. Then it comes down to good trial and error, good pragmatic, nutritional, i.e. orthomolecular medicine. And that's where experience comes in. And that's really the bread and butter of what I do. I don't claim to have cures to patients. I claim just to work with them, get into the trenches with them. I'm their advocate. I tell my patients, listen, I will work with you, I'll be on your side, but don't give up. You have to be very patient with this process. And you have to be willing to go along this journey with me. So it's not so simply that you can test for these things. It's about knowing how to apply nutrition in a clinical setting and just working with the patient, picking up on the little nuances of getting a little bit better, or understanding what other factors may be part of their whole history. I mean, we're certainly not just nutrition. Psychosocial factors are huge. How well does someone relate to their family? Is someone working and functional? You know, all these things. What do they eat? What is their diet? Are they exercising? It's certainly not just orthomolecular medicine, it's a holistic plan. And I tell my patients, I am just a stop that you're making today, but what you do between office visits is literally the most important thing you have to do. How you live between office visits is far more important than what happens today in this room. So I really try to make them understand that bringing wellness into their life, trying to optimize their quality of life is the most important thing. Finding a joie de vivre, feeling hopeful for once. Having love, finding happiness, joy. I mean, I have so many patients that have no hope, and no one gives them hope. And when they ask their doctor, you know, maybe these medications aren't helping me, is there any chance it could be undoing my recovery? They're shamed. They're told that you need the medication for life. I mean, I don't like to foster a system of dependency. I like people to have resiliency and optimism and a sense of empowerment. And I think it's completely different than what, unfortunately, the norm is. So orthomolecular medicine is really part of a holistic treatment plan that is very difficult to explain. It's arduous, it's hard, but ultimately I think it yields a much better path. Bet you didn't expect that, huh?
Anything you gave me, that's great, thank you.
Bro. Sorry, I can get going on tangents, I apologize.
Hi, if you're new to this field, is there some research that's been done in some other areas to go to look at how this has progressed over the years?
What is interesting is the journal began really in 1967, although I think the first issues were really 1968. But even long before that, there were a lot of pioneers in medicine. William Kaufman, not just Dr. Abram Hoffer, who were using large doses of nutrients as a means to get people well. And they were publishing back in the 1950s. And even before that, I just wrote an article on dementias and vitamins. And even before that, in the 1930s and 40s, there's lots of interesting research about nutrition and even dementia. So the reality is this, there's a lot of evidence for nutritional therapies, not just published in journals that go back decades, but in modern day journals. It's just a matter of knowing how to search for this information. The Journal of Orthomolecular Medicine, of which I'm the editor, of course I'm biased, I think it's a very good source of nutritional information, but there's many other. There's Journal of Nutrition, there's nutrition reviews, there's even mainstream medical journals that aren't even geared toward nutrition, that publish nutritional information. So the reality is, all you have to do is know how to search. And once you know how to search on Google and PubMed and All Health Watch and all these databases, you'll be amazed at the world before you that will be revealed about how much evidence and there is about orthomolecular and clinical nutritional medicine. It's just mind-blowing. I don't know what else to say about that because I can't teach you where to go, but if you just start on Google Scholar, that's a good place to start. Just type in some things and you'll be amazed at what comes back.
You can also go to the website orthomed.org and go to the journal section, and you'll find 40 years of research available at no charge on the link through the Journal of Orthomolecular Medicine. So orthomed.org.
Thanks, Stephen.
Hi, I have two quick questions, or a quick question about the two films. One related to access, and then another question related to how medical training has changed. So the second film seemed to be made around 2000. It's 12 years old.
1998.
1998, so it's 14 years old. I'm assuming the ISO was a part of producing it. So I guess the question I have is it possible for you to stream it on the internet so that there's no barrier to access, so you wouldn't have to come to a screening to see it, and thousands of people who come to your website can easily see it, given the fact it's not a year old, it's many years old. Second question is, given the fact that it's 1998 that film was produced, and now it seems that this information is out in the ecosystem, do you know how it's affecting medical training now that we're 14 14 years past the second film, and whether orthomolecular is now part of the vocabulary of modern medical training.
I'll let Stephen answer the first part.
For the first question, the film is available. Masks of Madness, Signs of Healing is on YouTube. It's on our site. You can view it at any time. We added it to the presentation tonight, even though it was made in 1998, because, and you'll probably recognize several of the presenters in both films. The first film, 1998, was meant as a educational tool, and the original version was 50 minutes long, and I edited it down to 15 minutes so that it could be used. Simply, all the points are on that film that are in the larger film, and the 25 talking points of that film are also on our site. So go to, again, orthomed.org. You can view that film, share it with friends anytime you want. It is a free access. The Feed Your Head was premiered in at the end of 2009, and the final version was launched in 2010. It's been shown all over the world in several different versions. It is not yet available as a free download, but we're hoping to do that by the end of this year. We're still exposing, going into festivals with that film. So that's about the logistics of those two films. And Jonathan will talk about the growth of orthomolecular since.
Your next question had to do with how much has this concept or idea permeated into, I guess, the mainstream. Well, it's a difficult question to answer because it's not so easy. The word orthomolecular is a complex word, so it's even hard for a lot of people to pronounce that word. The good news is it certainly has permeated. There was a huge campaign run through the International Schizophrenia Foundation several years ago that lasted quite long, that was there to educate the public, and it achieved that. The word orthomolecular became far better known, and there was a lot of media and public attention geared towards just this educational movement about other options of mental health care. Now, what's happening in mainstream medicine, I think they sort of look at this with interest, but not much more than that. The majority of clinicians who practice this form of therapy or this way of using clinical nutrition tend not to be MDs. They're more naturopathic doctors or, people who have nutritional training. And we are the people generally who have adopted this, who try to help people when they want this type of service. Unfortunately, mainstream doctors, it's not that they wouldn't be interested in this. I think a lot of them are. It's just it's not part of their formal education. They maybe get 25 to a maximum of 30 to 50 hours of clinical nutrition, but it's not even based on a real modernized paradigm. It's still rather antiquated. Doctors like myself, I've had over 300 hours of clinical nutrition easily. Then my internship was focused largely on the application of it as well as other modalities. So it's a very different sort of way that one's indoctrinated into this therapy from my medicine compared to mainstream, but we're really not against each other. I think there's so much collaboration or so much that can be learned from both forms. So I think things will change, but it's going to take a long time, unfortunately. There's a question over there.
There's a lot of variation in the quality of vitamins and supplements out there. How is one to determine what is good quality vitamin material to take?
I think that's dependent on the practitioner. I have a lot of my patients use a lot of the mass-produced products because I visited a lot of their plants. I visited Swiss, I visited Jameson. Natural Factors is in BC, but they're probably the largest. All of them have pharmaceutical standards. But a lot of people dismiss those companies because they're mass-produced and they're available everywhere. And, I think they've been given a bad rap. Even Life Brand is often private labeled through one of the companies that I mentioned just now. So I'm not against any of these very mass-produced products. What I am against is sometimes they use a lot of excipients, binders, and fillers, which very sensitive patients may react to. And in those cases, then you may want to use more professional brands like Thorne Research, where they've removed all that. But generally, I don't use very expensive things. I don't carry my own dispensary. Patients will buy them. I'll give them recommendations as to where to go. But I'm not someone who thinks you have to go expensive to get better. You can get some very inexpensive vitamins from Costco, the Kirkland brand, from Walmart, their Equate brand, from Loblaws, their Exact brand, and still do very, very well. I don't believe you have to go expensive or go home,
Actually, I had not a question, but a comment on the question before the one you just answered. And I'm not an expert at all, but I'm a client of Aileen Burford Mason's, the orthomolecular nutritional consultant who appears twice in the longer film. And I know that Aileen is currently teaching medical students at U of T. And she said it's very exciting. I wish I knew what the course was called, and I'm sure in number of hours it doesn't come near the training a naturopathic doctor.
Yeah, it's not medical students, it's actually a continuing education program for medical doctors, and it's been heavily attended, which is great.
Yeah.
But still, you know, they're very entrenched in a paradigm, and to be honest with you, I don't think your health is dependent on your medical doctor knowing this. I mean, the reality, even though we're in a mainstream medical school, I went and looked at Dr. Hoffer's picture in 1949 here. It's really cool to see how young Hoffer looked, very handsome. But the reality is, who cares? I'm gonna be honest with you. They can perform their job and do a good job of what they do, but you don't need them to learn this information for you to get better. You can empower and educate yourself, and you can use the system to your advantage and use other people. Whether they learn it or not, you don't have the time to wait. It's about personal empowerment, and you have to learn where you can go to get the help you need. So yes, it's exciting that she's doing that continuing education for medical doctors, but the reality is it's very basic, to be honest with you. It's giving them just a taste of what this is all about.
But at least it's starting to happen. There are conventional doctors who are getting into it, which is not to say they would replace the kind of work you're doing.
She's had a question for a while.
It seems that people are worried about our nutrition, and seems that people are pushing vitamins, but it's been known for a while that our food isn't as nutritious as it once was. Like, why aren't people looking into more topics like maybe crop rotation and whatnot?
Yeah, I agree. I mean, it's very important that we understand where our food comes and how there's been so many soil depletions as a result of modern food processes. So the reality is you really have to become your own experiment when you're living in this world. So you have to figure out what types of foods to eat, try to go as organic as you can, and you have to try to live as cleanly as you can, but it's very difficult. I'm not a black or white person. I don't believe in building Rome in a day. And it's very hard just to tell somebody, maybe on a fixed budget, limited income, just to eat organic. I mean, it's really about incorporating wellness, as I've said. It's about trying to help somebody find ways of exercising or achieving a different look or look into what health really is for them, as opposed to what they're used to. And it's a very long, drawn-out process, but it does encompass absolutely good eating. That's fundamental. As Aileen Burford Mason said so eloquently, our brain is this nutritional hog, and so much of our metabolic fuel is used by this 2-pound organ in our head. And what we see on our plates really does affect our brain, and a lot of people don't think that way, and she was so eloquent in the way she put it.